So we explored the prefix and suffix. Let's now look at some common terms in pathophysiology. Some terms such as condition, which is a state of being. Anything that disrupts the body's normal homeostasis can be considered a condition. Bone fractures, visual deficits, infection diseases. Then we move on to disease. What is a disease? It's a medical condition, usually with negative effects, that is associated with a specific list of signs and symptoms. Parkinson's disease is an example of a non-infectious condition that affects the nervous system. Another common term, acute, refers to a condition or disease that has a sudden onset or a short course in the body. An example of that would be strep throat. Chronic is lasting long time, maybe a lifetime. Diabetes mellitus, heart failure are considered to be chronic conditions. What about latent stage? A latent stage is a stage that deals with infection disease process during which the pathogenic agent is in the body, but is not in active form. So it's inactive, right? So some examples of that could be like the varicella virus. It causes chickenpox, but it remains in a latent stage in the body and becomes reactive years later as shingles. What about the terminology congenital? This means present since birth, but not necessarily is genetic. So a baby can be exposed to syphilis during the birth process, will be diagnosed with congenital syphilis. Again, it's not genetic, but it's congenital. So what is genetic? Genetic is caused by mutations or other problems that is transferred or development of genetic material. So this genetic condition caused the most form of, we heard of, is Down syndrome. Let's move into infectious. It refers to a communicable disease caused by a pathogen, such as a bacterium or a virus. And an example of this would be HIV. We kind of explored signs and symptoms in the past, but let's review again. Signs is objective indicators of disease that are obvious to someone other than the subject, and a Lyme disease would be considered, the bullseye rash would be considered a sign for Lyme disease. Symptoms is subjective feeling. A patient may complain of shortness of breath, which could be a symptom of heart failure, could be a symptom of COPD. And syndrome. These are a collection of signs and symptoms or conditions that often occur together, creating a named condition. A great example of this would be metabolic syndrome, because a person may have increased blood pressure, high blood sugar, excessive body fat around the waist, and abnormal cholesterol or triglyceride levels. So these are a couple of pictures of Lyme disease. That's that bull's eye that we were talking about. And then this is congenital glaucoma. Again, it's not genetic, it's congenital. And the last slide looks at a syndrome. So you see a lot of signs and symptoms that this person may have who has Cushing syndrome, which is a endocrine disorder, but you see that the weight gain, fatigue, glucose intolerance, these are signs and symptoms, depression, anxiety, increased risk of fractures. Thank you for exploring some key medical terminology as you move through the pathophysiology.